of misconceptions surrounding physiotherapy, and today we're gonna bust the most common ones. Number 15. Physiotherapy is for slimming and bodybuilding. Well, I'll start off by saying that physiotherapists can give exercises and tips on slimming and bodybuilding, but physiotherapy is not restricted to just physical fitness. When it comes to keeping fit, we believe that the person should take a wider approach to get the best results, and that often includes a full physical examination by us, followed by expert advice and hands-on techniques. While physiotherapists can assist you with toning up your muscles and slimming down, it is wrong to assume that that is all we do. Number 14. Physiotherapy hurts. No. On the contrary, if you have pain, the goal of the physiotherapy treatment will be to actually reduce your pain. Having pain reduces movement, and lack of movement can cause pain. So somewhere in between, you'll visit the physiotherapy department because either you're not moving properly due to pain, or you have pain so you're not moving properly. As physiotherapists, we have to correct whatever is causing the problem, and that sometimes includes adjusting your joints, releasing tight bands in the muscles, which can cause discomfort, but trust me, we do it to prevent your problem from worsening. So it really just depends on your condition and the severity. Otherwise, most treatments are painless and are aimed at relieving your existing pain. Our main goal is to assist you in moving properly, so we have to eliminate everything that's stopping you from functioning to the best of your ability. Next, all physiotherapists are gym trainers, and all gym trainers are physiotherapists. Again, no. However, there are some physiotherapists that have interest in working in the gym, but that will not usually be their full-time job. It can be part of what they do on a daily basis. But there are also other physiotherapists that do not engage themselves with gym training at all. Number 12, you always need a medical referral. So guys, here's the thing. If you work in a hospital, you might get most of your patients referred from different departments within the hospital. But there are cases when the patient comes to us directly without a referral. That's still totally fine. And if your condition is such that it needs further investigations that cannot be done by us physiotherapists, we do refer you to other departments as well. And sometimes there are chances that you might be referred back to us depending on your reports or results. 11. I can do physiotherapy by myself. I think it's time for people to start understanding how engaging this course is and how much time we dedicate to studying. It takes 2 to 3 years to do your diploma, 4.5 to 5 years for your first degree, that's your bachelor's, and then 2 years for a master's degree, and a PhD takes about 3 to 5 years. So there's definitely a lot involved than just watching YouTube videos and thinking you can do the treatment by yourself or you can perform it on somebody else, maybe your relative. We do give you homework though, and what we teach you for your home exercise program is just something to enhance your healing process, and also we believe in your active participation. Physiotherapy is usually not entirely passive. We encourage the patient to be as active as possible, but we do apply techniques that can only be done with special skills. Certain techniques done by yourself could actually be dangerous and make your condition worse. Physiotherapists understand this and apply these with caution. Number 10. Google told me this, so it's correct. This is similar to what I just explained, but I'll just add one more thing. There are certain patients that come for therapy and they start telling you how to do your job because they read this and that on Google. There's a high chance that you're gambling with information. There's so much wrong information on the internet, you guys. Not everything you read is correct. It's always better to go for expert opinion, and if you're still doubting, go for a second expert opinion. Most physiotherapists will value your ideas and will most certainly clear up your doubt. Moving on, number 9. Physiotherapy can cure my pain in a day. Physiotherapy can actually take a long time, you guys, depending on your condition. We understand the disease process, and just remember you're coming for rehabilitation. It's not a one-day job, and we don't ask you to keep coming just for the sake of it. You have to understand the awesome, rewarding feeling we also get once your rehabilitation is successful. You tell us your problem, we find the solution. So we're basically on the same page here. We also want you to get better, but the treatment has to be effective, so it can take some time before we begin to see complete and satisfactory results. Remember, we don't want you coming back to us with the same problem, all because we rushed through your treatment. Number 8. Physiotherapy is only for injured people. Yes, we often see people that require physiotherapy after an injury, but saying that physiotherapy is only for injured people is definitely a myth. It's a very wide profession. We see pediatric cases, neurological conditions, cardio, orthopedic cases, and we also have a very sound research base, and we're also involved in community-based rehabilitation programs, education, and all those things. So it's definitely more than just treating injuries. Number 7, physiotherapists can prescribe medication. As of now, we do not prescribe medication. We do, however, know about the medications. We study pharmacology for a minimum of 1 year, and we understand the pharmacokinetics, pharmacodynamics, and all those things. We use this information to understand the patient as a whole. Some medications might interfere with physiotherapy treatments, and physiotherapy treatment might interfere with some medications. So sometimes we just have to apply caution before we give treatment. We do, however, administer medications via phonophoresis or iontophoresis. Number 6, physiotherapy and nursing are the same thing. This is not true, you guys, even though there are, a few gray areas here and there, but we do not do each other's jobs. Physiotherapists are more concerned with physical rehabilitation. For instance, we'll be with you from your first day at the hospital and way after you've been discharged, whereas the nursing care might stop once you're discharged. So some of our aims are similar, but we definitely have different approaches. Number 5, physiotherapy is all about massage. This is probably the most talked about misconception. I've met a couple of people that have asked me what I do for a living, and I say I'm a physiotherapist. And they start saying, oh, I need a massage. I don't really know the reason, you guys, for this outdated misconception, but there's a possibility that it's a lack of awareness about our field. Massage therapy or soft tissue manipulation is only a part of physiotherapy. It's not what physiotherapy is all about. Number 4, another one is that physiotherapy and occupational therapy are the same thing. There's often a lot of confusion. I think many tend to be curious about this one, but I'm here to tell you that even though there are quite a few similarities, there are several differences. For example, occupational therapy tends to focus more on the fine motor skills, which will improve the person's ability to perform their activities of daily living. Occupational therapists are also involved in integrating you with your home or office environment by adjusting the environment to suit you, so you shouldn't be the one trying to suit your environment. Physiotherapy focuses more on assessing, diagnosing, and treating movement dysfunctions, so this is more to do with gross motor skills. Number 3, physiotherapy only deals with differently abled people. Again, this is another common misconception. Yes, we do play an important role in helping to improve their quality of life, but that's not our only area of expertise. Number 2, physiotherapists are doctors who fix broken bones. The truth of the matter is we do not fix broken bones, but we're there to prevent complications from arising before and after the procedure, and also to rehabilitate you once the fracture has healed. And finally, number 1, physiotherapy is all about exercise. Quite similar to the massage myth, we have to debunk this myth too, guys. Physiotherapy is a combination of so much more, not just exercise alone. Although exercise is a huge part of physiotherapy, it helps maintain and improve strength in our muscles, and your condition generally improves with exercise. Some patients tend to think if they just do their exercises at home, then they don't even need to visit the physiotherapy department. Home exercises are important, but they need a proper prescription by your physiotherapist in combination with other hands-on techniques. Alright, that's it. 15 misconceptions busted. Please don't forget to subscribe. If you have any more myths that you'd like to share with us, please feel free to comment. Bye!